I would just say, good luck for anybody who wants to try keto therapy. It's awesome. It can do amazing things. If you're on the diet, awesome work. You're seriously like a superhero. And more people need to share their stories about their keto journey so that other people can learn, I can do this too. While it's hard, it's doable, right? And we always think that we never know how strong we are until we try something that's hard. So, we can surprise ourselves. And so new patients looking at keto, they'll surprise themselves. They can rock it. So what I tell families is plan ahead. So know what restaurant you're going to ahead of time. Your family may have, for example, my family goes to like the same 5 or 6 restaurants on the island over and over again. So get to know those menus and know what you're going to order ahead of time. If it's a chain restaurant, Applebee's, Texas Roadhouse, the nutrition information is going to be available online. So that's great because you can look up, okay, this meal has this many carbs, this much protein, that sort of thing. So if you have that information, use it. If you don't, because it's maybe a local restaurant, that's okay. Go to the restaurant, they're going to have the meat, they're going to have the chicken, turkey, fish, eggs, whatever your protein source is, they'll have that. Ask them to cook it plain. That's not a crazy request. They'll have vegetables. What they may not have is the fat you like. So you may, again, have to bring your olive oil. You may need to bring a low carb salad dressing if that's where you're getting your fat, like a low carb ranch or something. So you may have to bring your fat source with you, but you really should be able to find like a protein source, a vegetable. But plan ahead, know what you're going to order ahead of time, maybe even have a backup plan in case they're out of something. And I also tell my families, if you're telling the server, hey, I'm on a ketogenic diet, I phrase it as, act like it's an allergy, because they're going to take that very seriously because they don't want to have any liability for any type of allergy related thing. So explain to them, I'm on a ketogenic diet for a medical reason. Please treat this like an allergy. I really need my chicken breast to be plain. So that way I don't get any, carbs I didn't see coming or hidden sources of sugar. So, some of our patients, depending on the diet they're on, they may lose weight unexpectedly. So even if a kiddo comes to me and say, they're getting 1,000 calories a day and they were growing great on that 1,000 calories, and I would know that because maybe they're just tube feeding, and then I put them on 1,000 calories of keto and now they're losing weight, right? So we do see some metabolic shifting where you do have to watch the calories pretty closely. But on the other hand, you can see the opposite effect too. So say I have a kid who goes on a modified Atkins diet and they don't lower their portions because visually, we eat visually too. So eating is so complex. And we look at the portions of a ketogenic diet, we're like, that's not enough food. So maybe we don't restrict our portions enough. You're going to gain weight. So we see the weights, depending on the kid, sometimes increase too much, sometimes decrease too much. Easy fixes, obviously, we just change the calorie level and we just educate on portions or wherever the issue is. Some of our patients, like our younger patients, may have some reflux, especially the babies. So we'll do small, frequent feedings. We maybe will reduce their volume. Again, we see it, but it's pretty easy to counter and treat. Occasionally, we'll see an increased risk of kidney stones. That's primarily more associated when the patients are also on certain anti-epileptic medications. But most of the side effects we see is easily preventative if you're followed regularly by a keto team, or can definitely be treated pretty quickly. I feel for kids because our societies are so oriented around food. Everything is about food. Every holiday, every birthday, every celebration is so food driven. And, as a dietitian, I'd love for society to get away from that, but we're not going. That's a pipe dream, right? So what I tell families, I say, okay, if, Johnny is going to a birthday party, let him go to the birthday party, plan ahead a little bit. This is where I would spend my money on a specialty product. Duncan Hines has a keto cake mix. Buy a specialty cake mix, make a cupcake, bring it to the party so that Johnny can have something with his peers. Maybe even reach out to the mom who's throwing the party and ask, what color is your icing going to be? So that you can, pair it as close as you can so Johnny doesn't feel isolated or different. Because it is different, and can be very isolating for these children. So if you can plan ahead a little bit, bring something to the parties, it makes a huge difference. For holidays, if you're going to a holiday party, bring a keto dish for everybody to try. And, so that so your son or daughter can see other people eating the keto food too. It's not going to hurt anybody to have, some keto stuffing, since Thanksgiving is just around the corner. But I also will tell families, because on the other side of it is, in clinic, even this week, I was talking to a newly diagnosed GLUT1 patient, and I was talking to the parents about, expanding the diet and trying some avocado and trying some cauliflower rice. And both of the parents gave me like this grimace, like, ugh, avocado. Well, the child sees that. And if the parents are having a negative association with the diet and a negative attitude with the diet, so is the child. So I told the family, I said, I understand you might not like avocados, but I need you to eat them for your child, because you're an adult and you can choke down an avocado, so that your child will learn to like them too, because maybe they really will like them, but they're not even given a chance because you're already being negative about it. So keeping it positive reinforcement about new foods, positively meal planning around holidays and birthdays. We send letters to school for all of our patients that says, hey, if you're going to have a party where there's going to be food involved, please let Johnny's mom know 3 days in advance so that she can prepare something for Johnny to bring. And it could be something as simple as like keto popsicles, or it doesn't have to be like some huge cake that's really involved. It could be keto cookies that you can purchase online, just something to make it feel more normalized. Grandparents are the worst. They're the best. And I mean with all my love, grandparents are the best, but yet the worst about this sort of situation, because they just want to come in and make their grandkids happy, and that generally involves food. So I have had hundreds of conversations in my career with grandparents. As a provider, I have no issues calling the grandparents directly and saying, hey, I want to answer any of your questions about the diet. I want to explain to you why we're doing this. It is not to punish Johnny. It is not a weight loss diet. We are really trying to help his epilepsy. And I know how hard it is to watch Johnny have a seizure. The grandparents have to associate, like, that is a hard thing to watch. It's heartbreaking. So if you don't want Johnny to have seizures, you need to get on board with this. And sometimes it's a little tough love, and that's okay, because as the provider, I can give that tough love. But I just tell my families, you have to be honest. Like, this is about the seizures. This is about a medical treatment. You wouldn't, go against, if your, family member had cancer, you wouldn't go against their oncologist recommendations. So why would you do it to their neurology care? And just explain to them, like, reminder, this is about the seizure control, and just harp on it. We also, again, we can write letters to the family member so that it's coming from a medical provider versus a family. We tell our families, hey, like, the Epilepsy Foundation has great videos explaining the diet, like watching videos about the diet for epilepsy can also help, I think. In the States, we, at least in our practice, we do use Epidiolex, which is a pharmaceutical grade CBD, rather often. it's probably been around for like 3 or 4 years, but nobody quote me on that. So we certainly have patients who are on Epidiolex and a ketogenic diet. We also have patients that use an over-the-counter CBD, although I don't see that as much anymore because we have the Epidiolex option now. But before Epidiolex, we saw that a lot. And the reality is I've seen kids who have done great on it. But then I've seen other kids who it's made no difference. And I've even seen some kids who it's made the seizures worse. So the benefits are, personally, what I've seen is all across the board. As a ketogenic dietitian, though, what I can say is CBD oils, most of them, and Epidiolex is very keto-friendly. They're generally mixed with MCT oil or some type of fat source. So it plays in the sandbox with keto very well because it's not going to throw you out of ketosis. It doesn't have a lot of sugar in it. There's no negative interactions between the two that I know of or that I've seen. So when I have a kid come to me who's on Epidiolex or CBD and we're thinking about starting keto, it doesn't raise any red flags. The keto shakes, whether you're buying like a pharmaceutical grade one, like your Keto Cow, Keto V products, or even something that's over the counter, like an Atkins shake, it doesn't have a lot of fat in it, so you'd have to add some additional fat to it. But those types of like convenience foods that we rely so heavily on, that's where I feel like that really has a role with keto therapies. Is not every day, but if you're traveling or going to Disney, that's a big question for a lot of my families because we're so close. Relying on some of those processed foods then can really make a stressful travel situation a little less stressful. A lot of the powders come in, or a lot of the formulas also come in powder, so they're easy to fly with versus the liquid versions. But I think that's a good staple to have if you're going to be out and about and you don't want to have a cooler with, an ice pack and all that sort of thing with it. My biggest suggestion is meal prepping. Take one day a week, just one day, and prep as much as you can for the week. While that day is a lot of work and it's rough, especially your first few weeks, it's going to make your life the other 6 days a week so much better. So if you prep all your meals ahead of time, you aren't going to run into a situation where I don't know what to eat or I don't have the right food. It saves you from being in a situation where you don't have the right food, you eat something you don't, you throw yourself out of ketosis and you have a seizure, and then you're out for the next day because the seizure wiped you out. Don't do that to yourself. Take a day, prep, organize, set yourself up for success. The other tip I always tell families is whether it's pediatrics or adults, clean when you're getting ready to go on a diet, clean your pantry out. Don't have chips and cookies and cereal, and all these things that you can't have on the diet. Don't have them in your house because then it's tempting. And, there's no reason that the whole family can't go on a low carb-esque diet. I'm not saying everybody needs to go on a keto diet, but, if you have a 6-year-old who's on keto and you also have a 4-year-old, it's okay if neither one of them eat goldfish. They both could eat keto crackers. So really just trying to get away from the barriers or the things that will throw you off and planning ahead. It's just amazing how healing a diet can be. It just blows my mind when we're able to help children with epilepsy get control of their seizures for the first time in their life through nutrition changes. It's just incredibly rewarding.